Hello, everyone. We welcome you to this edition of News You Can Use. I'm your host, Thera Martin-Milling, and so glad to be with you as we find ourselves in the holiday season, the month of December of 2014, starting to really wind down on this year. And we're glad to be able to take a look at some important issues as we wind down on this year and wind down on taping our shows for this year, News You Can Use. So to join me in discussion about something very important today, I'm delighted that my dear friend Carol Rogers is back with us again, and she is here representing on behalf of Healthy Philadelphia. Welcome. Thank you for coming.
Thank you so much.
Yes,
it's great
yes,
to be
yes.
here.
We are going to come back with our guest and continue with the program and have her talk about Healthy Philadelphia and the importance of enrollment for this health insurance. Stay with us. We'll be back in a moment. Here we go. We're back with our program, News You Can Use. I'm your host, Thera Martin-Milling, and I tricked you, didn't I? You thought I was going to start the interview right away. But we do have a very special guest with us, a lady that I have known all of my adult life, I believe, really, here in the city of Philadelphia. I have interviewed her more times than I would ever be able to count, largely on radio, and once before here at LaSalle TV. And so we're glad to have her back again. Carol, thank you for being with us.
Oh, it's a pleasure, and thank you so much for helping to get the word out about Obamacare and all the great news. We're really excited, and since it is a holiday, let's just say do yourself a favor and sign up for health insurance.
Your gift to yourself, health insurance, that's important,
right.
and it's important.
And it's going to be much better this year for people in Pennsylvania. So we are now currently in open enrollment for Obamacare. Or the federal marketplace. It started November 15th. It goes until February 15th. So people who make a certain amount of money can get assistance on the federal marketplace to help them pay for health insurance so they can access the health services they need. Last year, even though Obamacare was great, the way Obamacare was supposed to work was that people who made above 138% of federal poverty level, which is about $16,000 for one individual, would get marketplace insurance and assistance to pay for that. And people who made below that, Obamacare was designed so that the states would expand medical assistance expansion. When the Supreme Court ruled on the legality of Obamacare, or the Affordable Care Act, they found everything was legal except the part that said that states had to expand medical assistance. So unfortunately, governors were in a position of making a decision themselves about whether they wanted to expand it or not. Our governor, Governor Corbett, did not want to expand it right away. Many states around us, people who enrolled in states surrounding us, Pennsylvania, New York, Ohio, West Virginia, all of them expanded it, and in those states almost everybody could get health insurance. But in Pennsylvania, we had the horrible situation where people would come in and they would apply and they would think that they were getting help, yet they were turned away because they made too little money. And you know, that's not really the way things are supposed to work. The way things are supposed to work is that the less you make, the more help you get. Unfortunately, without the expansion of medical assistance, it did not work for so many people in Philadelphia and in Pennsylvania. But this year, fortunately, Governor Corbett did expand medical assistance. I will talk in a minute about some of the problems with it, but the good thing is that previously, medical assistance was for people who were disabled, for people who were extremely poor, like 30% federal poverty level. But this year you can have a job, you don't have to have children, and you can be eligible for medical assistance. And enrollment for medical assistance started yesterday, December 1st. I'm not going to tell people that there weren't some problems with the website. But I will tell people that as it gets closer and closer to our new governor, things are going to get much better.
But the other piece is that for those who just don't want to do the website thing themselves at home,
Right.
you got to keep your ears open and keep your eyes open. There's all kinds of locations, from elected officials who are hosting special sessions to various groups,
Right.
Better Health Network and all those types that are offering a chance for people to come out and have experts there,
Yes.
navigators they call them in some cases, in other cases they
yeah,
call them
they have
something else, but
different
people
names.
can help you get it done.
Exactly.
Yeah.
They have in-person help for
Yes.
people. We have them at the free libraries.
I am such a senior citizen. Oh my God. Let me just confess, I'm one of those people, I had to go. I
No.
mean, I'm computer literate. I'm on the computer 24/7. I think I'm very, you know, up to date
Right.
and whatnot with technology on the computer and all of that. But that, trying to navigate myself and my husband at home, and we're both intelligent people, college educated people, so on and so forth.
Right.
It wasn't working for us. And finally, I gave up. He didn't give up because, you know, sometimes men just gonna keep on trying even though it's not going well. But I'm like, okay, I have a headache. I am tired of this. We're getting ready to miss the deadline. I'm going to go and get signed up, and did it that way.
You're absolutely right. Many, many people had trouble with the
But I'm
website.
embarrassed. I wish I could have
Well,
figured it out.
I mean, there's nothing to be embarrassed about. I work with healthcare every day, and
Yeah.
yet sometimes you need help. And sometimes you need a set of eyes that's used to getting through that
Sure,
system. So
sure.
we really urge people to get in-person assistance. As I said, at the free libraries, I know you're going to run a number where people can call to get in-person assistance. They
Yes.
can find out a site near them. The Better Health Network is going to have a big faith weekend on December 14th
Okay.
at many of your churches. And what I'd like to mention is that if you're a pastor or active in a church ministry, please call the number and we can hook you up with the Better Health Network, who can give you resources and information to get out to your congregation.
Okay, sounds
Yeah.
good. That sounds good. Now give us the phone number while we're at it anyway, and we will, you know, mention
Well,
it a couple more times. while
I
we're
have
talking.
so many phone numbers. So there's going to be a
Pick
number.
one.
Well, the number to call, I think, is 267-207-3645. And these are people that I work with very closely, and I will make sure that they know how to get in touch with the Better Health Network, and also how to get in touch with it's now called the Department of Human Service,
Yes.
previously Department of Public Welfare, to enroll in medical assistance. People can start to enroll. As I said, there have been problems with it, but we really urge people to keep trying, and if they continue
They
to have...
just opened a new office, in fact, on Marshall Street in North Philadelphia.
right?
And that's going to be the central location for the no longer Department of Public Welfare,
Right.
now the Department of Human Services, to get people signed up for the healthcare piece who are
Right.
under that realm of funding.
Right.
Yeah.
So if you make above 138%, which is about $16,000 for one individual, or for 4 people, $33,000 a year, you should go and get in-person assistance to sign up on the federal marketplace for Obamacare and get help to pay for an insurance plan so that you can get insurance. If you make less than that, you should call the DPW number now. Office of, what's it called?
Department of Human Services.
Yeah,
It's all
Department of
in
Human
one ball.
Services to enroll in medical assistance. For Obamacare, there's a deadline for the open enrollment, which is February 15th. And we're really urging people to try and get signed up before December 15th, because then you'll have insurance starting in January. Now, many people got Obamacare last year. They got help to get insurance through the federal marketplace. And even though their insurance will roll over, we're really urging them to get in-person assistance as well, because often insurance plans will change. They may cost more. There may be something better for you. You want to check out and see what's in that insurance plan. So you want to go and get assistance to choose the plan that is right for you. And when you go, there are certain things that you should take with you. You know, it does take a few times, sometimes, for people to get signed up. You want to take your Social Security numbers or documents for legal immigrants, and that's for everybody in the family. You want to take the name of employers and income for each person in your family. Take your insurance policy numbers if you already have insurance. And if you enrolled in the marketplace last year, and if you remember your password, take it. Now,
we
know.
I never remember passwords.
Well, we know many people
So I can't get on
won't.
my computer at home right now.
Right. Right.
crazy.
We know many people won't, but if they have it,
Yeah.
it'll make it go a little bit more quickly.
Okay, all of that's good information. So good, and I'm just so glad that you're able to be here with us so that we could share it here at
you.
LaSalle TV. And I just am so thankful that this program gives the opportunity for rebroadcast, because this is important.
And I am so
There's no
grateful.
reason why anybody in the city of Philadelphia should be sitting at home thinking, oh, I'm sick, and I can't go to the doctors, I can't get health care, I can't access health care. Those days of saying those words should be over, right?
For most of us, absolutely. Now, there is one thing I did want to talk about, and unfortunately, it would be great if healthcare, if everybody was just covered and if we didn't have to worry about this. Unfortunately, the Corbett plan for medical assistance expansion really slashes benefits for many people that currently are on medical assistance. Now, we know that as governor, he will be leaving as of January 20th. The governor-elect Tom Wolf has said that he wants to have a traditional expansion of medical assistance, which will restore benefits. But people are currently getting notices that they're going to be put into one of 3 plans if they're currently getting medical assistance. There are 3 plans. They're called Healthy Plus. If they say you're in Healthy Plus, you're okay. Healthy, and there's another one called the private coverage option. So if you're in either of those 2, you need to appeal it, because those really slash the benefits, and you may not be able to get the care that you need when you need it. It's very easy to appeal.
Scary.
It
Very
comes in the
scary.
package. Just make sure that you keep a copy of it and a receipt if you go into the welfare office.
Medical care and health care in America. I
Well-
mean, so when you say to me that some people's health care benefits may be slashed somewhat because
Yes.
of our current governor and the decision he
Correct.
made. So like if I am a cancer patient and I need certain kind of meds and my insurance coverage is saying, well, we don't cover that, so then I just don't get it?
Well, there's a way to fight it. Community Legal Services has an office at Broad and Erie. They have hours on Mondays and Wednesdays from 9 to 12 specifically for this purpose. Certainly people can call the number that's going to be running on the screen, and I will help them, and they can fight it. And as I said, it's a temporary problem for us because our governor that's coming in has said that he really wants a true expansion of medical assistance. But people need to pay attention if they get the notices in the mail, and if they do get them, and if they're put into either Healthy or PCO plan, they need to appeal it. There is a way to do that, and there is help available.
Well, I'm glad you're sharing the information on our program again, and I hope that a lot of folks who maybe sometimes are just channel surfing, you're channel surfing, and you're really looking for one of the movie channels or some other sports channel or whatever, and oh, what's that, 56? Who's that lady? And who's that lady sitting with her? Stay with us a minute. You might find out some important information that you can use. And I'm just so glad that, again, you are here to share. Give us that number again. It is running on the screen.
Okay.
Our
So-
production team is awesome.
Yes, they are. The number is 267-207-3645. You can find out where to find an in-person assister who can help you to enroll in Obamacare. And they will also give you my number so that I can help you with the number for medical assistance, and also if you have problems with medical assistance. And also let me not forget the Better Health Network. A big event, a big weekend on December 14th at many churches, many faith leaders will be having assisters in their church. They will be speaking from the pulpits.
And pumping it out.
That's right, and we're so grateful that they are.
Another component to this whole Obamacare piece is if you don't sign up and you don't have any health insurance at all, when it's time to file your taxes, you get a little penalty.
Well, you do
told.
if your income is high enough to do it. Most poor people will not really have to worry about the penalty. But let's face it, it's much easier to live with health insurance than without it. It's not something that you pay attention to until you need it. And when you need it, you know, I get calls every day from people who didn't sign up. They thought it was too expensive. They have problems. You know, I see people at community meetings all the time who went on last year, tried to sign up themselves, got the wrong information, and then tell me they had a gallbladder problem and owe $42,000 to the hospital. So really, there is help
crazy.
available. It's really, don't put it off.
Don't put it off. Listen, we are out of time, but I want you to give one wish for the new year because we are wrapping it up on 2014. So one quick wish from you.
My wish is that everybody can get decent health care so that we can all live healthy lives.
I knew you were going to say that. Thank you, and I love you so much.
Thank you so much, Thera.
All right, we're going to continue with this special edition of News You Can Use as we start to wind down on this year of 2014. Dr. Donnie Patterson is going to join me in our next segment. We're going to talk about the 10 top health issues that we need to be looking at as we go into 2015, and we're going to talk about some other things as well. Stay along with us for the ride.
I didn't think this could happen to me.
I just wanted to feel pretty.
I just put my drink down for a second.
I didn't want to hurt her. I didn't want to fight back.
Hi, I'm Thera Martin Milling, host of News You Can Use.
Hello, I'm Fire Commissioner Derek Sawyer. I'm your host of Freedom from Fire.
Hi, I'm your host, Todd Johnson, of a program called Bridging the Gap.
Join our hosts and their amazing guests only on LaSalle TV. Tune in to Comcast Channel 56 and Verizon Fios Channel 36 to check out LaSalle TV. You can get more LaSalle TV on social media, like LaSalle TV on Facebook, and follow us on Twitter at LaSalle TV Philly.
Check us out.
Bye for now.
Cyberbullying comes in many forms and can happen 24/7. If you or someone you know is a victim of cyberbullying, take preventative and assertive action. Keep evidence and document all instances. Remember to record dates, times, descriptions, and also save and print screenshots. Block your cyberbully and present your evidence to school officials or law enforcement. No one deserves to be a victim of cyberbullying, and together we can end it. For more information, visit stopbullying.com.
Hello, everybody. We are back as we find ourselves right in the midst of the holiday season. Here we go, here we go. Dr. Donnie Patterson by my side. How are you, my friend?
Great. How are you?
I am good. I'm good. I'm thankful to have gotten this far through the year.
Absolutely.
And I figure if I can get this far, I can make it on into 2015, right?
Absolutely.
Yeah,
Absolutely.
yeah. So I'm glad that we were able to have Carol Rogers with us in our first segment. The information she's sharing is so very important. And I was really imagining in my mind you all out here together because you're all about health, and she's really all about health, even though you come from different education streams to get to where you are today. But nonetheless, we are going to talk about the health piece in this segment. And I want you to share with our viewing audience, from your knowledge and experience, what you think the 10 top health issues are going to be for people as we go into 2015.
Well, you know, I don't think people really think about it this way, but there are a top 10 reasons why people die. There's global, and that list is different than the top 10 reasons for African Americans than the U.S.
Right.
So globally, globally, no matter America, anywhere, the top reason is heart disease. People, we really need to know our numbers. I talk about it constantly. Know your cholesterol number, know your blood pressure number. Really watch the foods that you eat. It really is related to our foods. So try to cut down on the fatty foods.
So globally?
Globally. Around the whole world is heart disease. And then, so globally, the next one would be respiratory problems, like people who smoke and have COPD, and then stroke would be high up on the list, and other things like diarrheal diseases. You know, people, they like totally get dehydrated from diarrheal diseases. So those things are top on the list. But in the U.S. and amongst African Americans, number one would be heart disease again, and then number two would be cancer. And so for men, it would be prostate, lung, and colon. And for women, it's lung, colon, and breast cancer. And then number three, the top three reason, I tell anyone who will listen, the top three reason why African American men die, accidents. Accidents. So that means that those are totally preventable. That means that those are things. So
Like you're talking like car accidents.
Car accidents. So the number one accident would be car accident. The number two accidents would be falls, people climbing up on things and falling and die. And then the number three reason, they say poisoning, but that's like drugs and alcohol. So our men do not have to die. And so I tell any teenage boy who will listen, you have to wear your seatbelts. You cannot race that other car. You cannot race the train. You know, nowhere that you're trying to go is that important because you may not make it there. And so I just encourage people to, you know, make sure that their cars are safe. Still today, there's so many people that say, I don't wear my seatbelt, and they're like, I don't like them, but they have been proven to save lives. Do you wear your seatbelt?
Oh, absolutely.
Okay,
absolutely.
100%.
Absolutely.
And then I have people that tell me all the time that well, they only wear it on long road trips.
All the time.
But there's
Because you can get a ticket.
You can.
I don't like to get
you
tickets.
You can, but you can also die because statistics
Right.
show that the majority of car accidents happen within 5 miles of your house. So if you're just like going down the street to the store, you can still get in a car accident. You can still get in a fatal car accident. It doesn't just have to be on the highway.
And most automobile accidents happen for people like 5 to 8 blocks from their home.
Exactly.
That's a statistic.
It is. So we have to encourage people, wear your seatbelts. Once you're in the driveway, you put on that seatbelt, and you do not go even a foot outside of your house without your seatbelt, and definitely on highway travels. So, you know, accidents, we can prevent these accidents. Don't climb up on high places and think you're invincible. You know, make sure that you have help. And absolutely, drugs and alcohol. You know, we're encouraging people not to binge, drink,
and since we're in the holiday season and all of that, and thinking about, you know, gift giving and our young people, our children, I'm thinking about the Today Show, Good Morning America, some of the other talking TV shows that I watch, we all watch in the mornings, and what I could incorporate into the show that we have the opportunity to do here at LaSalle University. And so the kids with the scooters and these bikes and the gifts that some of us are giving children for the holidays, maybe we need to be buying helmets too while we're at it?
Absolutely. I mean, I know that when we grew up, that helmets weren't the thing.
We just busted our heads.
Exactly. You know? I mean, with more and more knowledge about concussions, you know, you don't have to die from it, but concussions can really change a child's life. So they can have chronic headaches, and they can have slowing mental ability, and it can increase the risk of Alzheimer's for later. So we really do need to protect our heads. So if you're going to buy a bike, it has to come with a helmet, because they're going to want to ride that bike that first day. It has to come with a helmet. And for adults, be an example. I know it's not necessarily the thing you want to do to wear your helmet, but the kids are watching. So why is it okay for you not to wear your helmet and your kid has to wear your helmet? Your head is just as important, and they're watching you. So wear your helmets. You're going for a bike ride with your family, wear your helmets. You're getting scooters or anything that's going to be anywhere near cars, or anything that they can fall off of, like those little bungee things. Yes, wear a helmet.
Okay. So we talked about the fact that the #1 cause on a global basis is heart health issues. I haven't heard you talk about AIDS yet and where that is in the picture. And I also remember some years ago when I covered a press conference, I think it was with the National Urban League or something, and they were saying that the #1 killer of black men, and this was some years ago, was murder. So where does all that figure into 2014
Heart disease has never fallen out of #1. So I don't know what that statistic is, but maybe that's, a very local statistics, but heart disease is number one, and then cancer is second for African American men and accidents. So as far as HIV for African Americans in the United States, HIV is like number 11, 12, depending on the year. It hasn't made the top 10 in probably the last maybe 5, 6 years. Globally, HIV is probably the number 5 or 6 killer globally in the world. So it has made the world stage, and it's still very important, and we're going to talk about that a little bit later in the other segment, but it's still very, very important. We're encouraging people to make sure that you get tested. December is HIV Awareness Month. Get tested.
Kick off, December 1st every year, World AIDS Day.
Exactly.
And then the whole month they do stuff. The month of October, there's a lot of HIV AIDS education awareness. In June, there's HIV AIDS Awareness Week.
Yes.
So there's a lot, but it's never enough.
It's never enough. People will tell me all the time, well, I've never been tested, I don't have AIDS, but you don't know. People don't know, and even if you're with the same partner, you can,
I'm just thinking, you remind me, well, let me see. Last time I got tested was 2 years ago, Congressional Black Caucus. Yeah.
Well, I mean, people that are in monogamous relationships and aren't, high-risk drug, they don't necessarily, yes, you don't always know, but they don't necessarily have to be tested every 6 months, But definitely people that are high risk, they should be tested more frequently. And if you're thinking, I'm not sure when I've been tested, or if you're a healthcare worker, a policeman, a fireman, a dentist, you really, really should be tested at least yearly.
Okay. As we begin to wind down on this edition of News You Can Use, Dr. Donnie, any wishes that you want to throw out to the universe in these last moments that we have together, or any special health tips that you might want to give to folks to have them live healthy as we go into the new year?
Sure. So my motto. My motto is, I wish you the best of health, but if you can't be the best, you can be better. I want us all to think about what we can do better. We can exercise more. We can eat more fruits and vegetables. We can drink more water. We can stay away from soda. We really need to have a citywide, no soda week, maybe even no soda month. I mean, it's just so many health hazards. But we can cut down on sugar. No matter how healthy you think you are, we can do better. So I encourage our listeners to think about what they can do better and do it.
All right, sounds good to me, Dr. Donnie. We thank you. We value you for being a part of this show. Love you much.
Thank you for having me.
All right, and to our viewing audience, we certainly want to wish everybody out there who's checking out the program all the best as you head into 2015. Be positive. If you are an adult, 18 or over, take life seriously and get involved in the political process, because politics does help the world go round. That's it for this edition of News You Can Use. Peace and blessings as we go into the new year, and thank you to the team at LaSalle TV. Have a great day, everyone.